Welcome to today's webinar on digital navigation in retinal laser treatment. My name is Stephanie Georg, and I work for ODOS, the company behind the Navilas Laser System, and I am very much looking forward to today's interview as part of our summer school. The person we will be talking to today is Dr. Georg Spital from the Eye Center at the St. Franziskus Hospital in Münster. Welcome, Dr. Spital.
Hello, Ms. Gurka. I am delighted to welcome you all to this webinar and look forward to sharing my experiences here.
So, Dr. Spital, you are a retina specialist with a particular focus on the treatment of diabetics, and you and your team have more than 7 years of experience in using navigated lasers at the Eye Center. Before we get into the detail of specific applications, perhaps you can tell us a little about the profile of the eye clinic.
Yes, well, we have a large group practice in Münster and cover more or less the whole spectrum of ophthalmology here, apart from strabismus surgeries. We specialize in treating uveitis patients. We have a large anterior segment department. We offer refractive laser surgery and have a major specialism in the retina. And I am representing medical retina here. One of the areas we concentrate on is diabetic retinopathy and exudative AMD, and I also spend a lot of my time on rare and hereditary retinal dystrophies. So we have an all-round approach to care here, including surgery, and the advantage is that we can always coordinate effectively across disciplines because we are all in one place. Our referral flow comes largely from Münsterland and the surrounding areas, even up to a few 100 kilometers away. Here you can see a map showing where our patient referrals come from, which of course depends on the specialty that is required at the time. It may be uveitis patients who come from a long way away. For example, patients who need cataract surgery or retina patients, the pattern can vary considerably. But you can see that the patients referred to us come from a wide area, and we have recently had the opportunity to connect even more closely with referring doctors through a portal solution. The portal solution is a telemedical network where we can exchange image and patient data, and ophthalmologists can also use it to ask follow-up questions. Monitoring can be carried out after the treatment, for example, so that the OCT is taken closer to home but we still have all the OCT images, so we can also monitor patients and they then only have to come in if it is absolutely necessary. Here you can see that navigated lasering makes a report after the treatment, and digital networking also allows us not only to give the patient a doctor's letter, but also to share images and reports via the portal, so that the doctor who is following up knows exactly which laser power we used and where we applied the laser, and can also see the laser plan. Here you can see an example of treatment with a navigated laser. The patient is not blinded much and then a few photos are taken. This is paracentral lasering without contact lens. I can identify the fovea very quickly by a clinical examination on the one hand, but I can also overlay an OCT. An OCT-based treatment has been carried out here. You can also look for microaneurysms in the photo, where you can spot them in the angiography. So, you can use any imaging modalities that you think are effective, overlay them and therefore plan very precisely and create a very specific treatment plan. Here you can see how the treatment is carried out by transferring the plan that has been created to the fundus, to the live fundus image, and you can then see the laser spots. It is important to say that you should wait a few minutes after laser spots have been applied to assess their strength accurately. The treatment spectrum for diabetic maculopathy and retinopathy. In diabetic maculopathy, non-contact laser treatment is carried out and the microaneurysms can be used to guide it angiographically or clinically. However, you can also perform OCT-based treatment in the area of retinal swelling. Central serous chorioretinopathy. Here we have suprathreshold laser coagulation, which we use mainly for lesions away from the fovea. However, there is also the option of subthreshold treatment with a microsecond pulse laser, and we use this treatment method above all when there are larger areas very close to the fovea in central serous chorioretinopathy. Recently we have also included treatment for retinal tears increasingly in our navigated laser repertoire, which I did not originally think would be possible, because peripheral lesions in particular can sometimes be difficult to find, and I thought that would be better with a slit lamp-assisted laser system. But now we actually carry out almost all laser coagulation treatments with our Navilas. Vein occlusion, both paracentral and panretinal lasering are an option here. Paracentral tends to be used more rarely for venous occlusion to prevent edema. Panretinal laser treatment is performed over a similar area to treatment in diabetes, if proliferations occur or if there is extensive ischemia. On the right is a picture of a very narrowly lasered proliferative diabetic retinopathy. Here, the panretinal laser coagulation spots are perhaps set a little densely, but you can see very nicely in this image how evenly the spots can be positioned with this system. Here you can see a clinical case study of retinal coagulation in a foramen, and below that a small circular foramen. You can see here that once the lesions have been photographed, they are easy to outline, 2 or 3 with a spot spacing of 0.25. And then suprathreshold lasering can be carried out. In fact, you should definitely use suprathreshold lasering for these spots and make sure that there are enough white spots all round, especially at the base of the foramen. As I said, you can position the spots around the foramen very easily in 2 or 3 rows with a spacing of 0.25. They should not be confluent, but they should also not be too far apart in order to achieve good fixation to the lining. In a moment, you should be able to see how the laser coagulation is completed. Here you can see on the right how the spots have turned white and how evenly you can position them around the holes. In this case, it is important to achieve sufficient adhesion to the lining, so considerably more than with paracentral coagulation and slightly more than with panretinal coagulation.
Here we have recorded the treatment result with the non-contact Navilas wide-angle lens after 4 months as part of the follow-up.
Yes, it's an advantage that this can also be done contact-free. This proves once again that non-contact lasers can also be used in this area. You can see very clearly here that the spots which were originally white are now pigmented and have certainly achieved good contact and attachment of the retina here.
Finally, we have another exciting topic, namely training in retinal laser treatment in general, and on the Navilas in particular. What challenges do you see, and what new concepts have you implemented yourself?
With the navigated laser, we now have the option of connecting to the internet by means of an app. For example, I or another senior consultant can be involved in treatment by an assistant. The assistant can take the fundus photos and complete the planning, for example, while I can see live what is being done, and the assistant has a headset on so that they can ask questions live. And if there are no complications, you do not really need to intervene and you can get on with other work at the same time. Whenever there are any questions, you can watch and make any necessary adjustments. I think that this option is ideal for learning and very safe for both the patient and for the trainee laser assistant.
fürs Lernen optimal geeignet und als besonders sicher für den Patient und für den lernenden Laserassistenten.
Okay, so if we summarize all that, if someone said to you now, I can provide laser treatment from the fovea to the oris or otta with the Navilas, what would be your response?
Well, originally I would not have thought it was possible to go as far as the ora serrata. You have to use different lenses, of course, but it is actually possible to laser a long way into the periphery, and well, if you can't get to the hole with Navilas, then you usually can't access it with the slit lamp-assisted laser either, in my experience, and then cryotherapy is the next option, for example, or surgery.
Sind wir eigentlich schon am Schluss? Nur noch eine
Okay,
Frage.
so that's all.
Tipps hätten Sie für
Perhaps just one
Kolleginnen
more
und Kollegen
question.
über den
What tips would you have for colleagues who are thinking about starting to use the technology? What do they have to take into account? What do they have to consider?
Yes, I have a few tips for when you are starting out. You should not be afraid of the powerful technology in front of you. For the most part, it's self-explanatory, I would say. You know that the device works well, that it will laser where you set it. You are always in control of the screen. With panretinal lasers you might want to allow yourself a little practice time because you have to keep the lens straight, and that's a little different to slit lamp-assisted lasers. With paracentral lasering, you should take the time to laser a few spots and then, after a few seconds or even half a minute, check by taking a photo, because you will notice that the spots will continue to turn white for a while. So don't just continue lasering too quickly with an energy setting that may be too high. Recently we have tended to use wide-angle lenses, and we have the advantage that we also have wide-angle cameras which we can use to take photos if we find any indication that needs to be lasered in the clinic, such as a foramen. Even if it is difficult to see, you can mark it on there and view this image above, or even overlay it during navigated lasering if necessary. It is also helpful that you can easily laser indications that are difficult to see. This is also a big advantage for tumors and the like. And the very important advantage is the multimodal overlay option, which I always use when we have indications close to the fovea, in order to be able to mark the fovea exactly beforehand with the OCT on top. And this OCT image, which shows where the layers are thinnest, the fovea can be identified very clearly on that, which means that you can delineate the marked fovea very clearly on the fundus image and set up the corresponding zone where no laser treatment should be performed. Subthreshold, I think I mentioned already, is also best done with a navigated laser in my view, particularly because there is good documentation. We can see exactly where the laser spot should be applied. We can define it very precisely. And you cannot see the actual treatment. That makes it all the more important. Although you cannot see anything afterwards, you have this documentation and know the strength with which the laser treatment has been carried out and exactly where. And then you have it to hand when you see the patient weeks later, and you can see how the indication has turned out.
Dr. Spital, what do you think of the idea of starting with the Navilas, then after the first few laser treatments going back to the slit lamp to assess the effects there and get a feeling for how it looks on the screen of the Navilas?
I would generally recommend maybe taking a fundus photo afterwards if you are unsure. With a navigated laser, if you have waited a while, you can easily assess the actual spots. But especially with paracentral lasering, it can also be important not to laser too intensively, but to aim for a slight gray coloring. And if you don't quite have a feeling for it yet, you can easily take a fundus photo again with another camera as you are going or afterwards and make sure that it is all as you wanted it to be. I think that's about all I have to say about my experiences, if there are no further questions.
That's great. Thank you very much for your time, Dr. Spital. For those of you who would like to watch a treatment online with the Navilas, you can always make an appointment on our website. And of course, there will be more contributions here in the summer school. Thank you for now and have a nice day.
Thank you also from me and good luck with trying out the equipment and laser treatments.
Viel Erfolg beim Ausprobieren und beim Lasern.